Hello. Greetings to all the viewers. I am Dr. Alisha, a research coordinator at SIOR-COP, and today I'll be taking a session on scales of measurement in research process. Let me quickly share my screen with you. So talking about scales of measurement, the objectives of this session would be to understand why is there a need for scales of measurement in clinical research, what are the different types of scales with certain examples, and how we can apply the knowledge of scales in research. So starting with the need of having scales of measurement in research is the scales, they define how data can be categorized, how they can be measured, and how they can be analyzed. This will ensure that the results that we get are valid as well as accurate. The three main purposes of having scales is we can classify data properly. We can choose an appropriate statistical test, and of course, if we choose the best statistical test possible, the analysis will be effective and we'll get very accurate and valid results. Coming to the types of scales of measurement, we have four main types of scales of measurement: nominal, ordinal, interval, and ratio. We'll see each one of them and with an example that I've quoted for all the scales over here. Nominal scale is the first level of measurement scale in which the numbers serve as tags or labels to classify or identify the objects. In this type of scale, we mostly deal with non-numeric data and they're mostly named variables. Examples are gender, color, etc. There is no order or rank in this type of scales of measurement. It's just named variables that we look around nominal scales of measurement. Coming to ordinal scale of measurement, it is the second level of measurement that reports the ordering and ranking. Now, this is like a little one step ahead in the scales of measurement. The first one, the nominal scale, just had named variables, but here now we'll have named variables as well as an order. So ordinal represents order. So these will be named variables with order. The ordinal data is also known as a qualitative data or categorical data. It can be grouped, it can be named, and it can also be ranked. So this is just one step more from the nominal scales of measurement. We'll see an example here. If mostly like if you see totally agree, agree, neutral, disagree. So these are named variables, they've been placed in a certain kind of order. Apart from that, mild, moderate, severe, these also can be considered as the ordinal scales of measurement. Coming to interval scale, the interval scale is the third level of measurement. Now this is another one step ahead of the previous two scales. So again, nominal data were named variables. Nominal scale was named variables. Ordinal scale was named variables plus order. Now interval scale will be one more add-on. If you see here, it'll be named variables plus order, and you can measure the difference between the variables. This is also quantitative, where you will have numbers involved. So, but the only thing with this scale is that they will not have a zero as the starting point, and an absolute zero cannot be measured by these scales. Examples are temperature, IQ, pH. So these are examples of interval scales. Coming to the last and the fourth level of measurement scale, which we use in clinical research, is ratio scale. It is like it will combine all the four things. It has numbered and named variables, plus there will be order, plus the differences can be measured, and there will be an absolute zero possible here. So zero will be the starting point in these type of measurement scales. This is again quantitative, and examples of ratio scales are blood pressure, heart rate, length of hospital stay, etc. This is a summary of all the four scales possible. Like if you see nominal, there are named variables. A step ahead, named and ordered variables. Interval, you have name, you have order, and you can measure the differences between variables. And ratio will be name plus there'll be an order, plus you can measure differences, and you can have an absolute zero for the ratio scales. Now, how do we apply this knowledge of scales in rehab research? As discussed earlier, it can help us selecting statistical tests. We can also choose an appropriate outcome measure as per the scales that we have. It will help us interpreting the results and designing surveys and questionnaires. So choosing the appropriate outcome measure, suppose let us take this example, this research study, the effectiveness of a rehabilitation program on motor function or simply any kind of function in stroke patients. This is the research topic that we have. Now we will see how each scale can help us understand the purpose of the research better. So if we take a nominal scale, we can categorize patients based on the type of stroke, like is it ischemic stroke, hemorrhagic stroke, etc. This will help us identify trends related to specific stroke types, but it is not providing us details about how severe or how intense the stroke is. We'll just tell you the type of stroke when it comes to nominal scale. Talking about ordinal scale, we can use Barthel index, which is the measure of function, and which can help us identify about dependency of stroke patients. So here, ranking of function levels is available, but we cannot quantify the differences between the functional levels. Again, see here you're having a named variable as well as an order, but we cannot have the differences between those order. Coming to an interval scale, this can be used to measure, for example, if we have to measure depression, we could use a standardized scale like the Beck Depression Inventory. Here, it not only allows numbered variables, not only allows order, but will help us to get differences between the measures that we get, and it can help us understand the treatment effects. Ratio scale to measure strength, which was the first main example that we took, that effect of rehabilitation program on motor function, that is eventually measuring the muscle strength. We could use a dynamometer to record the amount of force, which will help us understand, get comparisons between the patients, and it will also have a zero starting point there. So this is how we can incorporate different scales of measurement in understanding, or in choosing a better outcome measure for the research study that we are trying to conduct. Coming to selecting statistical analysis, how these scales can help us choose a statistical test. For example, when we talk about nominal data, if we are categorizing patients based on gender, we may simply use a chi-square test to understand the differences based on gender. Ordinal data, if we use a pain rating scale, we can use a non-parametric test like the Mann-Whitney-U test, where we can compare pain levels between two groups. Talking about ratio and interval data, we usually use parametric tests like t-test or ANOVA if the data is normally distributed, or if the outcome measure is a parametric test, is a parametric measure. And other than that, we can also have Mann-Whitney-U test if it's a non-parametric measure. Interpreting results. So understanding the scales of measurement will help us in understanding the clinical significance of findings. Means how can we say that whatever we found is clinically significant? Of course, we have statistical tests to help us, but sometimes choosing the right scale can also make the work a little easier. So if your study shows that average pain level has decreased from 6 to 4, so you can say that, so which was measured on an interval scale. So if it has decreased from 6 to 4, you can say that the treatment was effective, and you can actually number the, or you can quantify the reduction. If you find that 80% of patients improved in the nominal category of activity level, you can confidently report that the population benefited from a certain rehabilitation program. So choosing a scale also helps us clinically report the findings of the research that we are conducting. How does scales of measurement help you design surveys and questionnaire better? Here are a few points. We can use nominal scales to answer demographic questions like gender. Then we can use ordinal scales to understand patient-reported satisfaction. For example, how satisfied are you with the rehabilitation services, or how well do you feel after a treatment protocol? So ordinal scales can be used, or could be put in questionnaires accordingly. And how interval scales can report specific satisfaction ratings on a 10-point scale, which will allow more understanding, and a more objective measure can be done with the help of interval scales while designing surveys and questionnaires. So that's all on scales and measurement. In the end, I'd just like to conclude by saying that when we select a scale of measurement, they help us analyze data accurately. It will help us interpret our results meaningfully and will also help us design valid surveys. This ultimately will, of course, enhance research outcome and help us promote informed clinical practices. So that's it for my session today. I really would like to thank all the viewers. I would like to thank Mrs. Manisha Sangvi ma'am, Parag Sancheti sir, and Apurva Shimpi sir for giving me this opportunity, and of course the PhysioTV team for giving me this chance to speak about research and different topics around research on the platform. Thank you very much.